Hello. What I wanted to go over today was sort of the second kind of component to our wellness visit. As we discussed earlier, that our components of our wellness visit include going over what screenings we want to get done, going over what lab work we want to do, and doing our physical exam and setting up our health goals. And sometimes that, is all we can accomplish at a visit. But we definitely want to make sure that we spend the time or have the time to go into diet and exercise as well. And sometimes we'll be able to accomplish that within that annual wellness visit time. But sometimes I might recommend that we make a separate appointment to go over that. And whether we do that in person or whether we do that online via telehealth, I think that it's an important component that I want to make sure you as a member understands that this is something that we are offered to you and you're able to do. And we certainly want to make it easy and convenient for you to be able to take advantage of these things. So the diet and exercise component of our annual wellness visit is great if we can incorporate it into the visit at the same time. But again, sometimes if we want to spend more time discussing it, I encourage patients to make a separate visit to discuss. And what do we go over? Well, first of all, diet. Diet is a very big topic. There are just many different resources out there that tell you many different things. And they're all, in a sense, valid. And a lot of them are valid because it just depends on your personalized history and what your personal health goals are as to what you may want to look at and do. There is the Mediterranean diet, there is a paleo diet, there is keto diets. And again, I want to be able to help steer you to what we may think based on the current medical problems you have and based on your family history, what diet might work best for you. So again, part of setting up a diet wellness visit is to discuss what diet might work for you. For those of you trying to lose weight, it also involves discussing, what's going on and the barriers to losing weight and what diet might work for you to help you to accomplish weight loss. Because within losing weight, we can try to lose weight on a Mediterranean diet, we can try to lose weight on a keto diet, or we can look at something like a fast metabolism diet as, another option. So again, I encourage you, if you would like to utilize some of my understanding of diet and training, to go ahead and set up a visit where we just discuss diet. And we can even set up some follow-up and accountability phone calls to help keep you on track throughout the year. When it comes to exercise, that is also another component. For some of us, we might be just at the point of just trying to move. For other of us, we might feel like we're exercising on a regular basis, but there is just a lot of components to exercise and important pieces of exercise that if I'd love to have the opportunity to discuss with you further. I think that any exercise program involves three components, and that's cardiovascular fitness, strength fitness, and flexibility. And while I know for most of us it might be just starting to move to take that first step, I think anything that we want to do to make a true impact on our health, we want to look at those three components of fitness and see how can we do that. And that's part of what we do with exercise consultation, is to discuss with patients, hey, what do you like? What do you not like? What do you find difficult in your schedule? Why is this a barrier for you? And so putting that advice into your personal framework so that we can set some realistic goals. So I encourage you, even if you feel like you're pretty much on track with a few of these things, to take, 10 or 15 minutes, schedule a telehealth visit or in-person visit, and let's talk about diet and exercise, because I truly believe that those are two very key and critical components to helping patients with longevity. Thank you very much for talking to us today with wellness. And in my next segment, I'm going to talk a little bit more, for those of you at Premier Visit, what holistic or functional prevention check-in is all about.